Welcome to the training session. Our topic for today is about moving and handling, and also it includes a lot of transfers, which we're going to talk about. Most important thing to remember about moving and handling is the fact that there is a government legislation called the Health and Safety at Work Act. And what that decision does is that it breaks down the responsibilities into what the employer is supposed to do and also what you as a care worker is supposed to do. So you've got a responsibility to take care of your own health and safety and that of the service user to ensure that you don't put yourself at risk, you don't put the service user at risk, or you don't put any other visitors to the property at risk. Repositioning. The next part of what we'll discuss today is about repositioning. So for every service user you look after, and especially for those who spend time in bed, it's very, very important you ensure that they're repositioned as often as possible. Now, the two key reasons for repositioning, firstly, to ensure the reduction in the chance of your service user getting a pressure sore or pressure ulcer when they stay in the bed for too long. Service user, there are two key reasons why your service users should be repositioned while they're in bed. One of them is to encourage mobility and prevent the occurrence of pressure sores. The second one is just to give them some form of physical activity that helps their entire well-being. So as a social care worker or support worker, it's your duty to try and promote their mobility as much as possible. Now, while assisting this person in bed, one of the things you should also remember is that you should ensure that you promote the person's independence. So if someone is in bed and you're giving them care, it's always important that you ensure that you encourage them to do as much as possible for themselves, and whatever they cannot do, then you're there to assist them. Now, though I say you're there to assist them, it is not there to do anything that can put you at risk or put the service user at risk. It's about making sure you do it in the safest possible way. So we're going to talk about two aspects of the moving and handling process. The first one of them is about positioning a service user in bed. So if you have to position somebody in bed or reposition them, there are various guidelines that you must follow. One of them is about ensuring that you've got the right piece of equipment. This equipment would be prescribed by the or physiotherapist, delivered to the person's house. And when you do go to provide care for them, you've got to make sure you use that particular piece of equipment in the most effective way. And the most effective way is the option that leads to your service user not having any form of injury or harm caused to them. So please always follow your care and support plans, and also follow the moving and handling plans that are in your care and support plans at the service users' houses. Now, when someone says equipment, don't only go to thinking about a hoist. A sliding sheet is a piece of equipment, and it's very vital, especially when it comes to repositioning. So if you're repositioning somebody in bed, you've got to ensure that first you've got the right sliding sheet for them. My assumption is that if you provide care for somebody in their own house, they would have been measured or assessed by the patient or therapist, and they would have given that person the right equipment. And in this case, would be a sliding sheet for you to use to reposition the person. So in that case, when you approach the person, always remember to speak to the person very clearly about your intentions, what you plan to do, so that they can assist you wherever possible. Okay, so you're trying to get that person's cooperation, you're trying to get their consent, and at the same time, you're trying to get their participation in whatever activity you're trying to carry out, which ultimately would end up in improving the person's level of care. So once the person consents to you assisting them, you've got the right piece of equipment. One of the things to remember is that, so once I've got the person's consent in assisting them with the move or reposition them in bed, what I'll do is I'll come to the front of the bed and I'll roll the person towards me. Once the person is rolled towards me, I will then insert the slide sheet behind them, and then once the slide sheet is well tucked halfway behind them, then I'll roll them back again onto their back. Now, the reason why I say you've got to roll the person towards you is because if you roll the person away from you and try to insert the slide sheet from this side, it's a less dignified way of doing it, because the person could roll into the wall, they could fall off the bed, or anything of that nature. But when you make sure that you roll the person towards you, you're standing right there, the person gets that reassurance that you're there, and that you're there to support them if in case they want to fall off the bed. It makes them feel well looked after, it makes them feel cared for, and as an ultimate principle of care, that's what we're aiming to achieve at every particular interaction that you get with your service user. Now, once they've gone back on their back and they're the sliding sheet has been inserted halfway, I want you to go back to the other side, roll them again towards you, and then you put or straighten out the rest of the sliding sheet behind them. So what will end up happening is that the person will be in a position where they've been rolled to either side, the slide sheet is right underneath them. Okay, now for some of your service users, they may have some form of lower body control, or they're able to stretch their legs out. Now if you're trying to reposition somebody in bed, and let's say you want to move them up the bed, for example, getting your client to cooperate with you could make that maneuver easy, because in this case what you'll be asking them to do is they'll be folding their feet, then you put a pillow at the bottom of the bed that stops their feet from going further. With your feet folded, what they can do is they can push up. When you say ready, steady, slide, they can stretch their legs out, and being on the slide sheet, it will automatically move the person up the bed if that's what you're trying to achieve. Okay, now if you're rolling the person from one side of the bed to the other side, like we talked about earlier, it will be for you to get the person to hold on to the side of the bed if they can, and as you say slide, they try and pull themselves to the side of the bed, and will help you with the whole movement of repositioning. Okay, so they try and pull themselves towards the side of the bed, and it can help you better insert the slide sheet that you're going to use to adjust the person's position while they're lying on your back. So again, it's very important that you get the person's cooperation, you get their consent, and then you also get them to participate wherever practical into the transfer process. It doesn't only help them feeling that you're just there to help them, it also makes them feel some sense of independence as they're able to help themselves as part of that moving and handling maneuver. Okay, so at every point, always check for comfort. Hi, Mrs. Smith, how are you feeling? Are you in any form of pain? Is there anything I can do to make your life is there anything I can do to make this maneuver easier for you? Or please let me know if there's anything you want to do and I can assist you. So checking for comfort, communicating with the person, letting them know what they're doing, all of that reassures your client. It tells them one thing, that you know what you're doing. Okay, beyond you know what you're doing, it also tells them that you're comfortable with them, you considered your opinion vital in the whole moving and handling process, and you're not just there to do the task and ignore them. You're making them feel part of it. There's some level of inclusion. Now they feel part of what you're doing, and anybody that feels that you're including them in what you're trying to do for them will always do everything to help you carry out the maneuvers that you're trying to carry out. When it comes to using Hoist, again, your client will have been assessed by the occupational therapist, and there'll be a Hoist in situ in the presence house where you can use it when you're trying to transfer the person from one place to the other. Now, depending on the type of Hoist your client has, always remember that you've got to check their ability to carry out a particular maneuver every time you do it. Now, it could say in the assessment that, let's say, Serge is your client and he's able to walk when he came out of hospital. He just needs to be assisted with a standing hoist to get onto the wheelchair. Now, a couple of months later, after having been discharged, I could have gone down in my health. I could have gone down in my level of strength, and I'm not able to do the things that I could do at the hospital when I was discharged. So it means that on a day-to-day basis, you've got to assess my level of strength. And if you have any concerns about what I cannot do that you would have expected me to do, that is your call to let the agency know immediately that the person that you had assumed was capable of doing certain things is not able to do them anymore. Okay, so I want you to bear that in mind. Now, your client might say they're able to do something, and you notice as part of the maneuver that they're not able to do it. Your client might say they're able to weight bear. They can stand for a couple of minutes while you assist them with personal care, maybe changing an incontinent pad. You might notice that that person is not as able as they said or as they think that they are. Again, the next possible action or the next action you should take would be to get in touch with your agency and let them know to say, been to Serge's house, he said he could do this and this, but in carrying out the activity, I've now noticed he's not able to do one thing or the other. What's going to happen is that your agency is going to kick in place a review of the person's manual handling needs, and as part of that review, they'll be assessing the person's strength and ability to carry out certain maneuvers. Beyond that, the moving and handling plan will be updated to tell you exactly what is the new and safest way to assist that person as you go to see them on a day-to-day basis. Okay, now coming back to the hoist situation, once the person is in a position that you find them, so they could be in the bed, again, make sure that the equipment you're going to use is in good working order. Once you check that the equipment is in good working order, you've also then got to check to make sure that the person consents or is happy for you to assist them in the way that you're proposing to. Okay, now if for any reason, which is unlikely, the person refuses for you to assist them, then again you've got to try and speak to them and convince them about the importance of it. So for example, the service user says to you, oh, I don't want to use the hoist. I'd rather the carer just picks me up. Now we know that it's unsafe for you to just pick the person up, so it'd be for you to advise the person to say, look, I think that it's safer for you to use the hoist because that's what you've been assessed and your care needs demand that I provide your care using the hoist. All right. So now, with that in mind, you've got to then give the person a chance to make a decision. Now, your clients, unfortunately for us carers, your clients have a right to decide what they want to do. So again, we've got to respect that right at every point. But in this case where your client is compliant, you've got the right equipment in place, you're confident of your training, then we have to make sure that your next step would be to effectively move the person from one place or the other. And I'll give you an example. If you're having the person transferred from a bed onto an armchair, which is next to the bed, you've got to follow the following steps. After having checked the equipment in proper working condition, gotten the consent from your service user, you've got to then approach the person in a very open manner, in the sense that you're coming forward facing them, they can see what you're doing, and you're telling them at every stage what you're trying to do for them. Okay, once you do that, again, you're reassuring the person that you know what you're doing. You're also making them know that you consider their opinion as part of the task you're trying to complete on this particular visit. Okay, now if the person has a full body hoist to use and you've got a sling, the same procedure we talked about, inserting the slide sheet underneath someone, would be exactly what you'd follow in this case, which would be rolling the person onto either side and very carefully putting the sliding sheet or sling in this case underneath the person to be able to safely carry out the transfers. Now, if the person is reluctant during the transfer, again, it's for you to stop, reassure them, explain to them the benefits of you trying to do what you're doing, and always add the fact that you're trying to make it safe for them and you're trying to prevent them having any pressure sores or any friction burns on their skin. That way they would understand that you're doing it in their best interest. Because as carers, at every point, we've got to reassure our clients, even when they have doubts, just so that they know that we're there for them. We're actually doing everything possible to keep them safe and keep ourselves safe. But ultimately, the client's safety is what you're putting forward to them as a reason to carry out the maneuver at this particular point. So you've inserted the sling, roll the person on either side, and like I said earlier, if the person can assist you, get them to do as much of that as possible within reason. So don't ask them to do something that they're not able to do. Okay, from a physical point of view, some of your clients might have a physical disability, and for that reason they're not able to carry out certain maneuvers or even roll themselves on either side of the bed. So in that case, we've got to again stand in front of them, roll the person towards you, insert the sling to the back, go on the other side of the bed, and again explain what you're doing, and then you roll the person again towards you and make sure that the sling is properly fitted. Once that's in place, it'd be for you to go and fetch the piece of equipment, which would be a hoist in this case, that was supposed to use for that transfer, and then explaining to your client, talking to them, reassuring them, you make sure that the hoops of the sling are hung on the hoist, because that's how we move the person to a higher level from where they're lying at that point. Okay, while you're doing that, also pay special attention to what hoops you're using, because they could be prescribed in some cases in the moving and handling plan. And also service users comfort. This is about the third or fourth time I'm saying it. That's how important it is. Always remember to check to see that your service user is comfortable as part of any moving and handling transfer that you're carrying out as a support worker. All right. Now, if you're moving that person for any reason and you notice that the equipment is not working as well as it should, then please stop using that piece of equipment. Use the emergency lowering button to get the person back into a safety position, and then you contact your agency or the hoist repairs team to be able to make sure that hoist is serviced and is in proper working condition. Okay, now inserting the slings, you've got to make sure that you're checking that you don't catch any part of that person's skin while you're inserting the sling underneath them, especially if you can't see what you're doing behind the person. All right, be very careful, making sure that their clothes don't get caught in it, making sure their skin doesn't get caught in it. And the whole point about checking for comfort is make sure that if this is happening, then you're able to pay attention to it and be able to do something to stop it. Now, you could have a client who, for one medical reason or the other, they've lost the feelings completely in their lower body or upper body or any part of their body. That means that if you're transferring that person and that person is hurting, they may not feel it to tell you that they're hurting. Okay? Now, I'll give you an example. A client was living with MS and they're paralyzed from their waist down. If you're moving that person and you put the sling where it catches that person's skin, and as you're moving it, you don't notice it, though it's eating into the person's skin, the fact that they've got no feeling in that part of their body, they may not see it. And what would you see? You're probably just going to see blood oozing out. Okay? Which is, again, is something that we do not want to happen. Hence the reason why when you're checking, bearing in mind your service user's condition, you've got to make sure that you ask them the right questions. Hi, Mrs. Smith. Are you in any form of pain? Are you feeling any form of discomfort? Is there anything I can do to make you feel a bit better as we carry out the transfers? Always talk to your client. Communication is very key. Now, it doesn't mean that once you communicate with them, once you follow the procedure, there won't be an accident. It just means that if in that case something goes wrong, the person would know that that was a genuine error. That wasn't because you didn't carry out the right practice. It wasn't because you were not doing what you're supposed to do. It was simply an error, and these errors are always going to happen. And when these errors do happen, what you're supposed to do as a responsible care worker is that you should report to your agency. Okay? If you have an injury or a near miss, that's an accident almost happening, you have to report it to your agency, because then your agency will take the steps in place or emergency procedure to ensure that your client gets the help that is supposed to get at that particular time to prevent any condition getting worse. Okay? So if it's a blister, if it's a blister they've developed when you're trying to move them, they'll make sure that it gets treated if it's necessary. Okay? So your duty is to follow the procedure, ensure that anything that goes wrong as part of you following the procedure is reported to the agency. And beyond that, you've got to monitor your service user's condition on a day-to-day basis to be able to assess what they're able to do, what they're not able to do. And it is only in that case that we can then safely move the person from one place to the other. I'll repeat the key facts. When repositioning somebody in bed, make sure you use a sliding sheet. And the way you use that would be to roll the person towards you, insert it halfway behind, go to the other side of the bed and roll the person again towards you. And the reason is that rolling the person towards you, it's a more dignified way of assisting somebody when it comes to providing personal care. Okay? Once a person is in place, get them to do as much as they can for themselves. The same applies for using the hoist. Make sure you've got the equipment checked, is in proper working condition. Any concerns reported to your agency or the repairs company. Make sure that the person gives you consent. They're happy for you to assist them, bearing in mind that they've got a right to say yes or no. Now, your clients have got a right to say no to using the hoist, but what they don't have a right to do is to then force you to manually transfer them and put yourself at risk or put them at risk. Okay, that's not acceptable. If it goes to that point, then you've got to let your agency know immediately and not do it and then let the agency know. If it's wrong for you to do it, make sure you let your agency know as it happens, or as the service user makes that request that you consider unsafe. Now, if you do that and you end up not transferring the person, one of the things I would stay with the service user would be that you'd insisted to do it in the safest possible way to avoid them getting into any form of harm. And you've also have ensured that you pass that information on, which means you're a professional care worker who knows what they're doing and would not go against the company's policy and procedure just because it's a decision that is made by the service user. Again, they do have the right to want to do something or not want to do it, but they do not have the right to put you at risk by making you do something that you very clearly know from your training that could potentially put them at risk. Okay, so those are things we're saying you always have to bear in mind. Now, once you've carried out the maneuvers, once you've repositioned the person in bed, always say thank you for your cooperation. Now, that goes a long way to say to them that though you're there to help them, you thanking them for their cooperation makes them know that it's important to you too, that you achieve that task. Not just a task to do, it's something that is important to you to achieve, to the point where you're showing some appreciation for them participating into the maneuvers that you just helped them complete. Now, if you do that, I can assure you the next time you come to provide care for that person, they'll be very cooperative, they'll be very open, and they'll be very happy for you to help them carry out that particular task. Okay, so I need you to bear that in mind as you carry out your duties as a care worker, especially when it comes to doing moving and handling tasks for your service user who's not able to do that for themselves. Ensuring that reassurance, checking for comfort, getting their consent is part of the normal day-to-day practice. Now, if you have a situation where the two carers, the two of you assisting someone with transfers in that person's house, there's got to be a very clear route of command when it comes to carrying out certain tasks. And when I say clear route of command, I don't mean somebody is better than the other. I just mean that in any particular activity that you want to carry out, one person has to take the lead. So if I'm working with Geraldine, for example, I'll say, Geraldine, you know what? You've been to Mrs. Smith a lot more times than I have. So can you please control this particular maneuver? She'd say, okay, yes, Sash, I'm going to do it. So let's go. So that means that in the actual activity of it, when she says to me, okay, we're going to move Mrs. Smith on the word go. So we're going to go ready, steady, go, or ready, steady, slide. It's always good to go ready, steady, go, or ready, steady, slide, because if you go 1, 2, 3, I can go at the end of 2, she can go at the beginning of 3, and that could mean that we could be pulling or stretching the service user. It could also mean that I could hurt myself by going quicker than my colleague is supposed to go, all right? And ultimately, that could cause discomfort for the client, which we don't want. So once somebody is leading the maneuver or commanding the maneuver, then we're more than likely going to be in sync to be able to slide the person off the bed or roll the person to either side of the bed at that command, okay? So please pay attention to that, listen well to your colleague, and always make sure that you go and that command as part of the moving and handling procedure. Some service users would have family members that live with them. These family members would have done things in a particular way that suited them or that they considered to be a safe way to do it. But would you, as a care worker who's been through the training, you understand the importance of safety, you understand the importance of comfort, ensuring the person is comfortable. There's certain things that you cannot do, okay? And the things you cannot do would include things like moving the person without a hoist when you clearly know that they need a hoist to move them, okay? Or moving the person up and down the bed or repositioning them without the use of a sliding sheet. Now, if you do those things and something goes wrong, you would be in trouble, regardless of whether the service user's family member asks you to do it or not. So please always make sure you follow your company's policy and procedure and the particular guidelines got for that individual when it comes to moving them from one place of the bed or getting them out of the bed completely. All right, always make sure you follow those two things. Another thing to bear in mind is that service users' conditions could change. Somebody who's able to do something one day may not be able to do it the next day. Again, on a day-to-day basis, you've got to do a quick assessment of your service users' capabilities, what they can do. If you notice that something that they would normally do, in this particular instance, they're not able to do, you have to make sure you let the agency know, okay? It could be your line manager, who could be a supervisor in a whatever care setting you're working in, but always make sure you report that concern onward, because if you don't and something happens to the person after you've witnessed that particular incident, then you'd certainly be blamed for it, or you could be in trouble for not reporting it on time, because like I said earlier, our duties as part of the Health and Safety at Work Act is to make sure that every action we carry out has no impact on the service user, our colleagues, or ourselves. All right, so I always want you to remember that.